COVID-19 case number 17 is a 48-year-old woman who was under palliative care for stage 4 breast cancer. She succumbed to her illness a week ago on July 13. The public is skeptical that she tested positive to COVID-19 when she was in fact a terminally ill cancer patient. Today, CEO of the Port Moresby General Hospital, Dr. Paki Molumi, and Dr. Kone Sobi, Acting Director Medical Services, clarified this.
Patient died of, spread of the disease to involve the rest of the body, and so that was expected, the cause of death. Unfortunately, the COVID-19 identified meant that it also complicated the illness. She was being managed as a palliative care, meaning supportive care. Really, there was no definitive cure for her.
According to the doctors, the directive to swab any patient who dies comes from the authorities, in this case the National Operations Centre. Swabs are carried out on the dead who have died with symptoms of severe acute respiratory illnesses.
Okay, so all swabbing and of the dead is a direction from above that we carry out swabs on all patients that have died with SARI symptoms, any symptoms of cough.
Dr. Molumi said the National Department of Health arranges for the swabs to be taken, especially on the dead. This is done by morgue attendants who, according to Dr. Sobi, are trained to test. Dr. Sobi also said under new SOE instructions, there are guidelines that health facilities have to follow, and one of them is swabbing of patients who die. In this case, the hospitals do not need the consent of the family of the deceased to carry out these tests.
So families do not need to be...
No, this is a direction. This is a law. This is a law. Just like we are testing for those who are alive. If you are, if you are symptomatic and person of concern, you have no right to refuse. If you refuse, it's a law. You're refusing the law.
There are two sections under the 2020 Pandemic Act, Measure 38, Diseased Persons, and Measure 31, Testing, but both have no specifics on swabbing or testing the dead. A search of any similar instructions under Emergency Orders Number 9, Burial of Persons, Number 11, Testing, and Number 12, Surveillance and Testing, also say nothing of the same. The media was told that matter remains sensitive at this time, and so the SOE controller and deputy controller would be in a better position to outline where this specific instruction is written, whether under the Pandemic Act or the most recent emergency orders. Salome Vincent, TVWAN News.